Welcome back to the Board of County Commissioners policy session on this November 23rd, 2021. Gary Schmidt, would you please introduce the first item?
Yes, Chair Smith. First session today is Performance-Based Ambulance Services Agreement. Commissioners, you asked for this follow-up session today, and there is a decision point for you. Philip Mason Joyner, Public Health Director, will present along with Bill Conway, our Emergency Medical Services Coordinator, and several guests. Philip, would you introduce our guests, please?
Absolutely. Good afternoon, County Administrator Schmidt, Chair Smith, and Commissioners. Our guest here today is the Chair of the EMS Council, EMS Division Chief Matt Dale with Canby Fire. We also have Division Chief Steve Bowie from Tualatin Valley Fire and Rescue, and Chief Santos, Josh Santos from Clackamas Fire District Number 1.
How do you do? Thank you for coming.
Really appreciate our partnership and the opportunity to present today. Mary, if you could please start the slide deck, that would be wonderful. We also have for county staff, Andrew Naylor with County Counsel's Office that's been helping us all along this process, and our EMS Medical Director, Dr. Ritu Sani, who is here today as well, both in the front row.
And Chair, Commissioner Fisher has joined us as well.
Thank you.
Hopefully it'll come up here just a second.
Would you like me to start while Mary does that?
Go ahead, please.
Okay, so the purpose...
Sorry,
The purpose of this afternoon's session is really to seek board direction on the path moving forward related to the ambulance service contract with American Medical Response Northwest. Staff recommendation, there's 3 options in the board packet. Staff's recommendation is option number 1, to continue to work with, to move forward with the extension of the current contract amendment with AMR Northwest to continue moving towards a performance-based ambulance services contract, while also providing enough time to update the county's ambulance service plan, which is interconnected to this work. This is a really technical topic. We're going to begin with providing some high-level background and information for the board and for the public on this issue, and then there'll be plenty of time for discussion and questions from commissioners.
And if I may, we really want, stakeholders and staff really want you to know that we understand how incredibly complex this topic is. So our goal today is to provide you with pertinent information to help you make an informed and educated decision. And we're going to do that today by talking about how we got to where we're at, where we're going, or what we've done so far, and where we think we should go.
Thank you. I believe our slideshow is ready, Philip.
Okay, great. And Mary, if you could go, I just covered the next slide. And if you'll go to the next one, Chief Dale will get us started with the presentation. Thank you.
All right. Thank you, Commissioners and Chair. And we'll start with Chief Santos.
Thank you very much. Good afternoon. Appreciate you having us today. Recognizing that there is some big decisions to be made in the future of the emergency medical services system here in Clackamas County, we felt like it was of value to present to you like the background of where we began as an EMS council and in developing our EMS strategic plan, what we've accomplished, where we're at today, and maybe most importantly, what's left to be done, okay? And the hope in this is that it will provide you with enough information and comfort to, as you make meaningful decisions for our future, because it really does matter today. So back in January of 2019, the EMS Council developed the EMS Strategic Plan. The goal of this strategic plan was to modernize our medical services delivery model here in Clackamas County. Right? So the timing of this was really on 2 things. Number 1, we had an ambulance service plan that needed to be updated. It hadn't been done since 2012. And that really drives a lot of what we do in terms of structure in developing a system. And then the second thing was we had an ambulance service agreement that was set to meet its initial expiration date in May of 2019. So with this in mind, we developed the EMS Strategic Plan, and in March of 2019, we presented that plan to you, the commissioners. And at that time, our plan was approved, and we were directed at that point to implement our strategic plan. So with this, and during that time as well, in conjunction with that, the decision was made to award AMR a full 5-year extension to their current ambulance service agreement, taking that expiration date to May of 2024. So that created amendment number 1 that you guys would refer to in the ambulance service agreement. So instead of going in 1, 2, or 3-year increments in the extensions based on performance, for the sake of ease, we provided a full 5-year extension. But in conjunction with that, and in an effort to avoid plateau or lack of movement in our EMS strategic plan, the commissioners asked the EMS Council present twice annually to you all on our progress and what we are doing in our implementation phases. So with this new direction, the EMS Council created the subgroup, the EMS Strategic Plan Task Force. And that group is made up of EMS leadership that covers nearly every fire department in Clackamas County, AMR, our medical director, both CCOM and LOCOM 911 dispatch centers, and public health. And we met for the first time in April of 2019, and I have to tell you, well, first and foremost, the picture of us is right up there. That was the very first time we met with this task force, and all but one is still here with the task force today. And it was a chemistry that can't be described from the first meeting that we had. We were a collaborative group that shared vision. We had passion towards making our county great as it relates to pre-hospital medicine, and we were ready to go to work, and that's exactly what we did. So from April to on, we started going with implementing our strategic plan, and then in November we got our first opportunity to present an update to you all, and then we continued with our momentum until we hit what we consider to be our first change in direction in March of 2020, and that is COVID-19, ladies and gentlemen. It literally dominated our world, and we were forced to redirect our efforts to mitigation, and you'll hear a little bit more on those efforts in future slides. But it slowed our momentum significantly. It didn't stop it, though. Everything that we had in motion, we continued to limp along because we wanted to see it to the finish line, but it slowed the progress of that, and it certainly didn't allow us to implement more new initiatives that we had set out in our strategic plan. But nevertheless, we continued moving. And then, so we kept working and through the pandemic and working on our plan. And then in November of 2020, we reached what we consider to be our second change in direction. And that's when the then commission made the direction to change to a performance-based ambulance service agreement, which would change the existing contract that we have that expires in May of 2024, and instead we've moved to a performance-based non-expiring agreement that would be implemented in January of 21, so that's just 2 months. The commission gave the EMS Council 2 weeks to develop some recommendations that could be for content that could be included in that performance-based agreement, and that would be presented in a special session in December of 2020. So with COVID and holidays, we couldn't get the whole task force together, but we got a subgroup, a smaller subgroup, and we locked ourselves in a room for a week and developed what ended up being a 16-page recommendations for inclusion document that was presented to the commission in December of 2020. And on that day, amendment number 2 was born. And that is the amendment to the ambulance service agreement that has the county and AMR negotiating in good faith to develop a performance-based ambulance service agreement. So we buckled up and we were ready to go to work and develop that. And then we had yet another change in direction in January of 21, and that was COVID vaccinations. So your fire partners, AMR, we partnered up with public health, and we were all hands on deck in vaccinating first our agencies and then our citizens. And you'll hear more about that in a future slide as well. And that was an all hands on deck, heads down for 6 months, vaccinating our citizens with really the goal of keeping us healthy and opening our businesses to keep the economy running. Comes July of 21, we were able to catch at least a little bit of a breath. And we got working on our strategic plan again in the performance-based agreement, and we were working on hiring a consultant in which we are nearing the finish line today as we speak, in hiring a consultant firm of content experts that would help us update our ambulance service plan and help us realize all of our lofty goals that we have for our county medical services delivery model. So that brings us essentially up here to today. I hope you find value in that background as we move through this presentation. And with that, I'll turn it over to the next presenter, and we can go to the next slide, please.
Thank you, Chief Santos. Good afternoon. I'm glad to be here to present to you today. Just want to talk a little bit about the COVID mitigation and vaccine efforts that your fire agencies provided and other agencies provided for Clackamas County. In past presentations, there have been some comments and questions stated by the BCC of what progress have you made, what's been accomplished on the EMS Strategic Plan, and we're going to share a little bit of those accomplishments with you on a later slide. But obviously, as Chief Santos said, the vaccine efforts and the COVID efforts slowed us down, and you'll see that the progress did continue. How did COVID impact your providers? So we began, as everyone else did, learning about a new disease, right, that was in our community that just like you were sitting in your homes looking at the news, your EMS professionals were learning about a disease that we knew not a lot about hour by hour. And as we began to deal with the response and mitigation work that happened early in the pandemic, we had to figure out how to protect our crews, what kind of personal protection equipment we were going to wear. We had to create policies on the spot to figure out how we were going to respond, because we needed to keep responders in the seats of the apparatus, being able to continue to deliver health care throughout Clackamas County. And that was a ever-changing target that as we moved through the weeks and then months of learning how to respond and be able to mitigate this disease. As Chief Santos stated, that later in the pandemic, when we kind of figured out our policies and we were kind of rolling and we got good personal protective equipment for our crews, we were able to keep people responding and keep responding to the calls for service. We were then called upon to help with the vaccine effort. And while that was not in our main mission, we felt, and it was pretty obvious to all the people in this room, that we were the right people to do that job. And the fire chiefs and the private ambulance companies and other healthcare professionals in the county agreed that we would need to be there to fill the gaps. So on the slide, you can see there were several vaccine clinics, both for first and second dose, that were done throughout the county. I want to just highlight a couple of them for you. And just to make a note that when we stood these clinics up, the fire agencies were responsible for putting together the protocols to deal with them. They were responsible for planning, coordination, implementing, staffing plans, and so forth in order to make these early vaccine clinics a success in partnership with public health. Clackamas Town Center was one of the biggest vaccine clinics within all of Clackamas County. We had another large one as well that's not mentioned on the slide here at Clackamas Community College in Wilsonville, where we did multiple different classes of eligible constituents from in Clackamas County, gave them their first and second doses of vaccines. All in all, your fire agencies provided 45,000 plus doses, which is pretty amazing when you step back and think about, we often ourselves reflect on what that took to do that and the effect it had on the organization. And I'm pretty proud that we were part of it, to be able to provide that. And like Chief Santos said, it was our goal to get the county back to work, kids back in school, right, as we all experienced in our lives, and really increase the health and welfare of the citizens within Clackamas County. And why did we partake in it? Because we were the right people to fill these gaps. I do want to make a note that, while we had this large national and global pandemic going on, as you well know, the county also experienced some record wildland fires in multiple parts of the county, an ice storm, a heat wave, and some civil unrest, all of which were some of the larger major emergency events that we've experienced in our careers, all happened during the same time period. Next slide, please.
So oftentimes we broadly reference EMS stakeholders. I want to take a moment to highlight some of those stakeholders, some of which are in the room today, including the chair of the Fire Defense Board, Chief Davis, who is in the audience behind me. The Fire Defense Board chief represents the 10 separate fire agencies that do EMS delivery throughout the county, as well as Jason Mill, the operations manager of AMR Northwest. Representing all career firefighters in Clackamas County, Clackamas County Professional Firefighters Local 1159. as well as the Tualatin Valley Professional Firefighters 1660. That represents the 7 Tualatin Valley fire stations operating within Clackamas County, as well as the Teamsters Union representing AMR. Other equally important stakeholders are both 911 dispatcher centers, CCOM and LOCOM, as well as our hospital systems and the 8 separate law enforcement agencies operating within the county. All provide input into this system. Next slide, please. So I want to highlight some specific accomplishments that we're very proud of that we've already accomplished. The first one I want to mention is standardized quality improvement, key performance indicators, and an electronic database that monitors in real time the EMS delivery that's happening in the field by our paramedics. Also, EMS kits and EMS charting, which are standardized, allowing paramedics to transfer documented information on the patient at the scene, at the patient side, as well as when we're working together across agency, as we often do every day. We're not having to dump a kit out on the floor in order for a caregiver from another agency to find the equipment needed to care for that patient. This speeds it up and it makes it a seamless process for patient care delivery. We are also moving in the direction of standardized common heart monitors, which is a huge accomplishment. And then a couple responses that we've changed is example of 2 pilots that we ran early on in this strategic plan draft is right now, ambulances and fire trucks go to 911 calls together. In this example, we've now send an ambulance only to medical centers such as Kaiser Sunnyside, leaving the fire truck back in certain medical calls, and also with non-injury or unknown of injury accidents, the fire truck only goes because that doesn't require an ambulance oftentimes. So doing that allows the fire truck or the ambulance in either case to be available for the next emergent call. And lastly, we developed, evaluated, and chose the contractor consultant to lead us through to the finalization of this strategic plan. Next slide, please. So this is a simple slide illustrating a complex system. The 911 system, when it began, was designed to respond to the calls in red on the left hand of the slide deck, which are very emergent and time sensitive for the patient and for transport to the hospital for hospital intervention. Over the past several decades, the 911 system has changed into a more of a basic healthcare access for most calls, and most of our calls are less than emergent in nature. Most people are surprised to know that the slide deck on the left, the emergent calls, and the calls that are maybe considered less emergent on the right, get the same response out of the 911 system, so as an example, if somebody called for a general ongoing illness and they were the first caller, the closest ambulance and fire truck would go to that. And then if somebody called a minute later for a heart attack, a further away ambulance and engine would be dispatched to that call.
Yeah, I think when we built this slide, the take home of this whole slide is this simple. The days of sending a fire engine and an ambulance to every single medical call, putting that patient in the back of that ambulance and sending them to the emergency room where they may or may not get the definitive treatment or the true treatment that they need has to end. Those days are over. It's not a sustainable business model, and it's not the right service delivery model for our citizens. So that's really the crux, the philosophy of why we're here today and what our goal is, and we have a plan to get there. We have a plan to get there. So we just felt like that was a really impactful thing when you look at the red versus the other colors on that screen.
Next slide, please.
Yeah, and how do we get here? So one of the things I want to spend a little time talking about is what is an ambulance service plan and why do we have one? Well, on a simplicity statement, you could say the ORS states that an ambulance service plan should support efficient, effective provisions for ambulance services. But what does that mean? And while this list that's up on this slide is not an all-inclusive list, I do want to point out some of the connections so that we make a really good understanding of how the ambulance service plan really drives everything we do with medical services in Clackamas County. So obviously, at the center of it all is patient outcomes, right? A lot of the things that you hear us talk about all the time from the EMS Council and EMS stakeholders is about how to improve patient outcomes in the county. And those patient outcomes, as Chief Santos just stated, are not just improved by getting people to the hospital. There's other treatments and other forms of outcomes and dispositions for patients that we could be doing preventively that are all driven by this ambulance service plan in the context of giving good patient care. So healthcare equity, that's something you guys have heard a lot about and a lot of people talking about that. And with COVID-19, that has become even more relevant and more apparent to healthcare providers across the country and in our region, that it really showed the disparity in healthcare that's out there. And the ambulance service plan is what guides a system and guides parts of systems that should be in place in order to provide healthcare equity throughout the county. It also tells you how many ASAs, how many ambulance service areas you should have and how they should be served and staffed. It covers contracts and intergovernmental agreements. And there's, if you're not familiar, there's several intergovernmental agreements and contracts beyond just the ambulance franchise agreement in Clackamas County that are here, and they're part of the delivery system for delivering healthcare in Clackamas County. The ambulance service plan drives how those contracts are written. It drives the operational models, and you've heard a little bit in the last slide about looking at other models. That's what EMS modernization is, and what our goal is as an EMS council and your EMS stakeholders is to modernize the system here. And that starts with having a modernized, updated ambulance service plan that will guide those operational changes needed to make a modernized, efficient EMS system. It also gives performance metrics. We're going to talk a little bit more about performance metrics later in the slide, but the performance metrics of how we perform in the ambulance service area within the county is going to be driven by this ambulance service plan. As you can see, it pretty much drives everything when it comes to delivering ambulance services in the county. So to develop any type of a service agreement or a contract without updating this plan would be counterintuitive. Next slide, please. Modernizing the ambulance service plan. So what does that actually mean? And we kind of touched on a little bit of it today in a few of the slides and in my last slide. But what does it mean? So one of the things is that to modernize something, you have to update it. And the ORS requires the counties to have a plan and review and update it every 5 years. As noted earlier, ours has not been updated since 2012. So what will modernization of the plan accomplish? It will accomplish changing and altering 911 utilization to get the right resources at the right time to the right call. It's going to address the healthcare equity we talked about. It's going to address the allocation of resources, like how we deploy, how we integrate public and private assets within the county to deliver healthcare and emergency services. It's going to improve the effectiveness of the system as a whole when you modernize it, because it's going to make it scalable and innovative for future changes in service delivery demand. And a real big one that we really want to highlight is going to formalize partnerships. We have a lot of partnerships. I mentioned contracts and intergovernmental agreements that we have. They're standalone separate agreements versus being all encompassed in the ambulance service plan and being a formal part of the EMS system in Clackamas County. And I think that's going to be a big change for the future. And it's going to provide modernized performance metrics to ensure high quality delivery of services. And if you can't measure it, you can't really, how are you going to grade how we're performing? How are you going to know that these patient outcomes are actually improving? So we need good performance metrics in order to monitor the performance of this system.
Yeah, so speaking to the importance of getting this right, normally in life I would subscribe to the theory of done is better than perfect. This doesn't fall into that category. We have a great opportunity here today. We have an opportunity to create a system that's reflective of today. It's scalable to tomorrow. It creates sustainable business models for both public and private. It'll ensure healthy workforce throughout their career and into retirement. And it will deliver the highest level of service to the citizens we are sworn to protect. And so with that, I think you have the right team here to create something that's lasting beyond this set of relationships, which is rare, and past future relationships that maybe aren't so symbiotic like this. And we just want to capitalize on that opportunity, and that just takes time and space. Next slide, please.
Performance-based contract. What is a performance-based contract? This is in your packet, and you've seen it before, so I won't spend much time on it. But basically, a performance-based contract is a contract that does not expire from time. It's a contract that is renewed or extended based on meeting a certain set of performance metrics. Some examples are operational and clinical. There's also reporting and some others. So operational could be, for instance, sending the closest EMS transport resource regardless of agency. Clinical could be compliance with key performance indicators such as heart attack and stroke. And then there are reporting and others. But again, you've seen this before, so I won't spend a whole lot of time on it. Next slide, please. So this is our revised work plan. Also, you have seen in your packet. I just wanted to highlight a couple of things real quickly. The ambulance service plan review and updates on the top. Performance-based ambulance service agreement is on the bottom. We feel we can have a final report submitted to the EMS Council for review as well as to the Board of County Commissioners in Q3 of '22. And if it's approved, then we can have it sent to OHA for review and approval and have it finalized Q4 of '22. And if you look at the performance-based ambulance service agreement, it's just kind of a step behind the ambulance service plan update so that we're ensuring that it is meeting the intent of the ambulance service plan. So we're working on both, but it's just a step behind. So our proposed work plan says that we'll have a scope of work finalized and have it ready to create a contract in Q3 of '22. In Q4 of '22, we would have the agreement to you for review and approval or not. And then if you do approve it, Q1 of '23, the performance-based ambulance service agreement would be implemented according to your direction. Next slide, please.
And thank you, Commissioners. Thank you to our fire partners for sharing their story and providing this great information. The revised timeline that Bill just reviewed is in alignment with option number 1, which is staff's strong recommendation to extend the current amendment number 2 with American Medical Response Northwest. It would allow us the time to work with the consultant updating the ambulance service area plan and then provide a performance-based contract for your review and approval in October of next year. With that, we're happy to answer any questions.
Presentation, wonderful. I think it shows all the work that you put into it. I can feel your passion and your dedication to this, and I really appreciate it so much. Now, my understanding is that the ambulance service plan needs to really be completed before the performance-based service agreement. And that's fine, and you're saying, Bill, they can be concurrent, but one has to happen here, and then here, and then we keep going across linear with your service plan upgrades. Now, in your service plan upgrades, and I've been asking this question, and I've talked to some folks. Since I was here last, so much has changed, I know that. But we approved the contract last time I was here. And I'd like you to address the growth in population. How flexible is this contract service plan, or maybe the performance-based as well, in accounting for increased population into our county and delayed response times because our transportation system is so clogged and antiquated? Can somebody talk to me about that?
I can start. That's exactly, that's a perfect reason that we need to update the ambulance service plan, because our county is getting bigger, there are more people, which increases the call volume, it increases the need for services, it decreases our response times. So as Chief Santos said, the days of sending a fire engine and an ambulance to every single medical call just is not sustainable. We need to find other ways to meet those needs, whether it be preventing the call beforehand, or a smaller, lighter force. There's so many different ways to address it, but that is a big part of what the ambulance service plan update will address. And it has to be, when Chief Santos says scalable, that's what we're talking about. It has to be scalable to meet those increasing demands in alternate deployment models and other things to answer the calls.
Going forward, when you time to come back to this board for an update, I like to see numbers, for instance. I like to see how many ambulances AMR has on the road or deployed at any one time versus what would be needed now and into the future. And then what would the projections be into the future of additional ambulances, for instance. I would like to know how often and when the ambulances are updated, replaced with new equipment or engines or buying new ones or that type of stuff. How many personnel are employed for Clackamas County AMR here in the county? Are those services shared with other counties who are also have AMR services, or are they shared with other ambulance companies who are outside of AMR scope? So a lot of information like that, and it all goes to serving our people with vast array of needs, vast array of medical needs, as you pointed out on your little dot. And we used to just do heart attack, strokes, and whatever that was, and now we have everything else over here, which is more. And it's quite the process, and yes, I'm very much impressed. Do we have any other comments or questions from commissioners? Commissioner Schrader?
Yeah, I just want to say I've been through this a number of times. This is the most organized, collaborative piece of work I've seen. So thank you so much.
Thank you very much.
These can always go get really interesting.
Commissioner Savas?
Yeah, I too want to just share my appreciation and gratitude. Well-done presentation, very comprehensive. Thank you so much. And by the way, also thank you so much for responding to all of our tragedies, so to speak, or crises. COVID, the shots, the ice, the fire issue, the ice storm. You guys nailed it. So I really appreciate the partnership with everyone in the room. We responded. And I'm pleased about that. One thing I did want to say, and especially coming off the heels of our visit down in Lane County, at some facilities down there during our AOC conference last week, and that was we visited some facilities, one in particular, the last one in Springfield, which was their wet facility for drug alcohol treatment. I do know that we have crises. People don't belong in the emergency room when perhaps they can be taken. Same goes for mental health. We need to make that investment, and there might be a time here soon where we appreciate your advocacy for that, but we need to be able to respond. I know your line of work and your business and your responses have changed because your constituent out there on the street has a different demographic than before, like never before. So it's a substantial impact to our system, and I think this timing for this performance-based contract is all the work you're doing is just perfect timing. So. And overdue, frankly, let's face it. Yeah. So
Good.
I'm all on board with option number one.
Thank you. Commissioner Scholl?
Yes, Philip Mason Joyner gave us a good brief last week on this, and I was convinced that option one's the way to go, and from what I heard from you three gentlemen, you agree. So I'm good. I'm good with option one.
Any other comments from commissioners at this time?
Do we need a motion?
Yes, we do.
Okay.
I
Martha.
move for option one.
Go ahead.
Chair, shall I read?
Yes, please. Well, I think we need to read it.
Yeah, it would go, we move to extend amendment number 2 and instruct staff to move forward with a performance-based ambulance services contract with AMR Northwest.
Thank you.
Second.
Motion has been made by Commissioner Scholl and Savas, seconded by Commissioner Schrader. I just wanted to make sure the intent was read into the motion. Any other further discussion on this really important piece of work for Clackamas County? Hearing none. Mary, would you please call the poll?
Commissioner Savas.
Aye.
Commissioner Fisher.
Aye.
There you are.
Commissioner Schull.
Aye.
Commissioner Schrader.
Aye.
Chair Smith.
Aye, motion passes 5-0. Thank you, gentlemen, for your dedication and hard
you.
work.
Thank you very much.
This is a miracle. This is a Christmas miracle.
You're so
It's like,
funny.
don't make me hyperventilating like this.
Chair, if you're willing, we can go right to the next policy session.
Please do, Gary.
Staff's here, all right. Well, thank you, everyone, for attending, and please be quiet because we have another session, everyone. Thank you. The next is Gladstone Library. So the team from Business and Community Services, please come forward. And we'll thank you, everyone, for please leaving the room because we have another session going on. Thank you. That works, too. Thank you. Sarah Ekman, Interim Director of Business and Community Services, would you please introduce the team?
Absolutely. Thank you, Administrator Schmidt. My name is Sarah Ekman. I'm the Interim Director with Business and Community Services for the county. Good afternoon, Chair Smith, Commissioners, Administrator Schmidt. We have a team with us here in person, and we also have some folks listening in online today. So in the room, we have Mitzi Olson, our Gladstone and Oak Lodge Library Director. We have Jason Varga, Project Manager for the Gladstone, Oak Lodge, and Concord Community Center projects. And we have Jeffrey Munns, Assistant County Counsel, who assists us with these projects. In the Zoom audience, BCS Interim Deputy Director Eileen Stein is listening in. And we also have Gladstone Counselor Mindy Garlington, as well as the Gladstone City Administrator Jackie Betts. Cindy Becker from County Administration and Project Oversight for this project is also listening in. We do have a slide presentation that was included in your packet.
Go ahead.
I'll get going on it. What we're here to talk to you about today is the Gladstone Library. We have a plan to build a new library, and we have two very specific questions for you today, which is your guidance on filling a funding gap, as well as requesting your approval to proceed with the project. But to set the stage for that, I want to give you a little bit of background, which is included in your policy session worksheet, as well as the slide presentation that will be coming up shortly. So you might wonder why we're building a new library in Gladstone. In October 2017, the county and the city of Gladstone entered into a settlement agreement in which the county agreed to construct and manage two new libraries, a 6,000 square foot facility in Gladstone for the library service area in Gladstone, and an approximately 19,500 square foot library in the Oak Lodge Library Service area, which is an unincorporated Clackamas County. This agreement in concept is known as the One Library, Two Buildings concept, which was agreed to by the county and the city of Gladstone. It was based on there being two library buildings that will be jointly operated by Clackamas County Libraries. The Gladstone and Oak Lodge libraries are the only two county-operated libraries, and those do fall within BCS. In November 2019, we entered into an IGA with the city of Gladstone. There's two components. The first is a library construction and operation IGA. That was executed, as well as a library facility intergovernmental agreement between the county and the city. In the slide packet that was included online, there are drawings of the library design that has been developed. And you can see from there that there is an overhead view. The new library is proposed to be on the corner of Portland Avenue and Dartmouth Street at what is the old Gladstone City Hall. The drawings in your packet show the interior and the exterior views to provide you an idea of what the library will look like. The library includes a wide variety of amenities, and we are on slide, 4, including meeting rooms, a children's materials and play area, a lounging and materials area for adults and teens, study rooms, staff area, public internet and duplicating services, outside area for programming or lounging, bathrooms, hold areas, and a foundation book sale area. So as I mentioned, the issues before us today are how to fill a funding gap for this library and looking for your approval to move forward with the final design, which still does need to be completed, and then construction. On slide 5, we have the planning task force who has contributed to this project significantly. I'd like to extend deep gratitude and thanks to the members of this task force. Their names are on the slide up here, and as you can see, there's a wide variety of people. There's at-large members, there's Gladstone Library Advisory Board members, Gladstone Library Foundation Advisory Board members, Clackamas County Library Board of Trustees, and these folks have been meeting since January 29th of 2019. Members of both the Gladstone Task Force and the Concord Task Forces selected the design team, which was led by OPSIS, who's our architecture firm. The task force members unanimously voted to recommend the master plan, which was accepted by the board on November 10th, 2020, so almost a year, well, just a little over a year ago. And then we have conferred with the task force members on what are known as value engineered changes to the design, which we'll talk about in a few more slides based on the budget. Next slide. As you can see, we've had a wide variety of events to conduct community engagement and get input from the community on the design. There were summer and fall workshops in 2019, as well as winter and summer workshops in 2020. Next slide, please. I think this project has been one we've been in front of the board with quite a bit, starting in 2017 when the settlement agreement was reached and finalized, and then picking back up when the task force planning began in November of 2018. So that's 3 years ago this month. Next slide, please. And here's some of the heart of the question today, which is around budget and funding for this. This slide gives you an idea of where we started and where we are today. So on the left, you can see our original budget was $6 million. This was pre-pandemic, and as I said, 3 years ago. In July 2021, we had the construction manager general contractor, first there was an estimate given to us by OPSIS through a different process of $7.4 million, and then the construction manager general contractor estimate came in. They were actually relatively close to one another, the first being 7.4 and the second being 7.7. Jason Varga, who's here to answer questions today, is our project manager. And through working with the CMGC on value engineering changes, they were able to get the budget down to $7 million even. And so below that, you can see the planned and available funding for this project, which make up 6.8, which is a $200,000 number less than what the budget for the project is. Next slide, please. So one of the questions before you today is how to fill this $200,000 gap. We do have some proposed solutions to address this shortfall, which are listed in this slide. There's 3 options that we've identified. The first is to reduce the construction, design, and owner contingencies by $200,000. This would still leave $700,000 in contingency, as $900,000 are currently budgeted. We could also increase the general fund portion of the revenue bond by $200,000, so this would increase our debt on the project, and as it shows there, adds about $14,500 per year to that debt service payment. The third option, which has been raised more recently, is to use $200,000 of ARPA funding from the county. Next slide, please. We have had recent conversations with the task force for Gladstone specifically on this project. We've shared the themes from those conversations here in this slide. To capture those for you in a broad way, there's frustration that has been expressed with moving timelines. In the next slide, I do address the timeline issue. We have been on time with this project. However, recently in October, did request a 4-month extension from the city of Gladstone, which is something that we are allotted within the IGA between the county and the city. That extension was approved, and that was something that was needed to allow time to reevaluate the escalating project costs, which have occurred due to the pandemic. So that is something that we have heard from them. Constituents do want to see the city hall torn down sooner rather than later. It's an old building that's been sitting there a while, and everybody would like to see progress. They'd also like to hear more frequent communication from us, which we hear loud and clear, and have already implemented a plan to do so, with a minimum of a monthly communication and oftentimes potentially more frequent. Everybody does want to remember that this was and still remains one project with 2 locations. And that's something that we also have heard from the task force. There's been concern expressed when the project was developed. There was conversations around economies of scale being realized by doing 2 projects under this. While the construction does happen in 2 locations, we are realizing economy of scale from combining library operational issues. And if there's questions, Mitzi has examples of those. And then the task force also recommended that it re-engage the art subcommittee to start looking at the art issues related with the library. Next slide, please. So to wrap up, we just wanted to confirm status, and this timeline here shows you that in October we did do the 4-month extension, and then we've had some conversations with you as well as the task force. November 23rd brings us to today, and then based on the outcomes of today, if there were to be approval to move forward, we would finalize the design. And the very last slide gives you an idea of what that project timeline looks like assuming approval to move ahead. So it does push us to complete the design, go into the permitting and bidding process, and then be able to break ground and start construction in the fall of 2022. So with all this in mind, we have the two questions before you today, one on the funding gap and the second on moving forward with the project. And our team's here to answer questions.
Yeah, I have three questions on this particular issue. What measures were taken to reduce the cost from 7.7 million to 7 million?
Great, I think Jason is
Yeah.
probably our best person to answer.
I can answer that. There's four, I would say, kind of more major changes. Can you hear me? Okay. There were four major changes. One is to change, it was a CLT, cross-laminated timber
What
structure.
does that mean?
It's
Cross-laminated
cross-laminated timber.
timber?
Yeah,
Okay.
exactly. To change that to a structural steel or a steel and steel decking. Another one was to eliminate the radiant floor heating in the, and replace that with, we have a variable refrigerant flow, which is a high efficiency mechanical system, basically to replace it with that. The other two was the sunscreen, that if you see in the pictures, you see this metal panel. That's reduced from what the original design showed. The original design had a kind of wrapping, or the length of the building almost in both sides. And it also had a privacy screen on the ground level that we've eliminated. And the last major one was the community room, which if you look at the sketch, that's kind of in the back on Dartmouth Street, towards the back of the building. We've reduced the ceiling height of the building in that direction, brought that down, and that brought some significant savings also. So those four were a big chunk of it. There are other smaller ones. We've got
But
about.
you just went through basically and looked at everything?
Yes.
To get to that,
Yep.
okay. I want to talk about contingency for a minute. Why do we establish contingencies?
This is my interpretation, is we establish because we're early in the design phase and we don't have the detail in the design to be, we need those contingencies as we move along in design to be, how do I say this? Basically, we draw down those contingencies as design progresses because we have more information and we can get more accurate
Well, wouldn't
pricing.
you draw down your contingencies at the end of the project, not during the construction of the project?
We draw them down during design, or the idea would be to draw some of it down during design.
Change orders.
Well,
Okay,
no.
sorry. Let me maybe explain. We have design contingencies within our construction budget, but we would for sure have a construction contingency during construction that we would keep. But as of right now, we also have design contingency within our budget that gets drawn down as we move along in design.
So on a $7 million project, you have almost $1 million in contingencies, correct?
Correct, right now. We would not have that much
Do you
before construction.
anticipate any contingency remaining at the end of the construction project?
We would hope so, yeah.
So if this board were to take $200,000 out of our ARPA funds and add it to the contingency, and the project was finished and you still had $200,000 in contingency, would you pay that back to the BCC and the ARPA funds to be used for something else?
That's a great question. I think that we could certainly make that arrangement if
I think
if
that
that's-
arrangement should be made. Also, I'm looking here at your very last slide, design complete the spring of 2022. That makes me so nervous. I understand it takes a long time to design properties or projects. That is also an opportunity for escalating costs for whatever reason. Oh, we don't have a labor shortage. Oh, all of our materials are stuck in a container in the Pacific Ocean. Oh, there's the pandemic. Oh, we have this. We have a riot. We have this. I mean, you burp. Essentially, a contractor or an architect will burp. The price goes up like that, and I'm so not appreciative of that. Every entity that comes before this board, I'm saying, you keep the cost where it is. Don't come back to this board saying, oh, in March or April, gee, our costs have gone up $500,000. Our costs have gone up $800,000. It just won't be tolerated on this project, on the projects we talked about this morning, on the projects we talk about next week, next month, and the month after. We have got to hold the line on the projects. The community out there has to know that Clackamas County does not have endless funds, and we do not write blank checks because of the inability of professionals to keep costs down. Is that clear? Is that clear?
It is.
All right. Commissioner Schrader.
I just want to say, I'm not going to disagree with you, Chair. But you do have to remember, I do think these are good professionals, but sometimes, and I want to keep it as low as possible. That's not my beef. What I want to just say is, though, remember, a lot of these things, like COVID and things that have happened, are totally out of our control. So, folks can do what they can to keep the costs down, and they will. But, we can't help the supply. It's out of our job range to make sure the supply chain out in the Pacific Ocean is
I know,
coming
but
back to
Martha,
port.
I'm getting kind of tired. I'm getting kind of tired of that attitude. Oh, we can't help any of this. What we can do is start saying no to some of this stuff.
Well, we may have to.
That's how we can help it.
No, I'm not disagreeing with
We
that
have
at all. I'm
inherited
just,
this huge construction abyss in this county. We have so many opportunities on many projects to move forward. Some of those are not going to be realized, I'm afraid, because I want to see them all go. They're not going to be realized if people keep holding on to, for instance, the attitude, well, things go up in price. Oh, this is government, things go up in price. We just can't manage our budgets that way. And so,
I see, I hear what you're saying. I'm just trying to say that, then we're just going to have to cut certain things again. We'll have to keep an iterative. So you think you're here, but then you're finding out that you're going to have to do more value engineering. And will that add cost, too, is the other question. Because that's pretty much your only, what the option would be to continue. If it goes up that much and we want to hold the line at this, we're just going to have to cut another piece of the project out, if we do anything at all. That's just, wouldn't that
Yeah,
kind of be what would happen? Yeah, so that's what we'd have to do, which is fine, if that's what we need to do.
Yeah, I agree. I think, we will do absolutely everything we can to hold the line. I think there are times when if we end up in that situation,
Just
what's being
cut.
shared is, we would
Find
have
something
to,
to take out of the building, yeah.
to reduce the costs and bring it back in line.
thank you. I appreciate your dedication to those efforts, and I know you have heard me loud and clear, and those listening have heard me loud and clear. Just know that this board and this chair is not a pushover for increased costs because of whatever reason. Projects will have to be redesigned or put off on hold. Mark?
Yes. I have a few questions, just to clarify some issues here for Jason. I'm sorry, your name, ma'am?
Mitzi Olson.
Mitzi Olson. First question. The $7 million that the project's been value engineered down to, in that $7 million, does the $700,000 contingency lie in that $7 million?
Yes.
Okay. 2, are you sure, and going from 7.7 million to 7 million, that was pretty significant, I think. But are you sure at this point, Jason and Mitzi, that there's no fluff left that could be eliminated from the project to make up that $200,000 shortfall? Are you convinced that the value engineering that brought it down to $7 million got it down just to the basic, you can't go any lower than that, this is the project that we need to build? Is that right?
I mean, we could go lower than that, but then it'd be going to really basic.
Okay.
low efficiency mechanical, you know.
Okay,
it
okay,
was-
good, okay.
I
good.
think we've gone down to
You're
a
comfortable.
reasonable level right now. And,
Okay.
you know, one of our suggestions was possibly use contingency that we have right now.
Yeah, okay. Understood, Jason.
that's-
Okay. Next is, does the $7 million in this budget now include all of the required design work to get this project done?
Yes.
It does. And are you convinced that we're not going to see a new amendment come in requiring more money for design? Are you convinced that we can build this project with this money to include design, to include the bidding process, and getting this project actually built, and kids and moms and dads going in and checking out books?
Yeah.
For $7 million?
It's all accounted for right now in the budget, yes.
Okay. If you're comfortable, Mitzi, you're comfortable? Okay, thank you.
Commissioner Savas.
Yeah, I do want to point out something that came up at the meeting on Monday night, and staff spoke to it. It's on one of the bullets here. I'm going to find it here again.
Sure, go ahead.
Sure. Yeah, it's the second bullet from the bottom where it says task force feedback. And again, staff's referenced it a couple times, that this settlement or agreement with then Administrator Krupp was, and myself and others, was one library, two locations. And there are assets and amenities that will be in each of these libraries that essentially will make a one library whole, essentially. So the agreement anticipates that if there is not one of those amenities at the Gladstone Library for a Gladstone resident, let's say, then it'll be at the Oak Lodge Library. So the calculations, the square footage, and the balance of these two projects are tied together. It's like a pair of shoes, if you will. You know, you don't buy one shoe, you're buying two. What we're buying right now or approving is one of those, with the other one to come, you know, in the near future. Granted, the scale and the size are different here. But that was expressed by them, and it's not lost on any of the two library task force groups. They know that. So this project has been farther ahead a little bit for a long period of time. This group is a task force. I appreciate all the hard work, but this has not been easy. I want to just kind of give my appreciation to not only our staff historically over time in solving these problems, but whether you're in the community of Gladstone or you're in the community of Oak Lodge, Jennings Lodge, or you're in between in some of that gray area, there was a lot of machinations and ideas, and staff has really done a fantastic job, past and present, in trying to manage all that and get us in a good place. So, and so I think we have community agreement. I think this project is the first one ready to go, with the other one to follow as soon as we get things lined up correctly. And I think the funding gap here is small. So I just want to say that, just kind of give a shout out to everyone. This has not been easy. It's extremely complex, and we're not going to get into the weeds. We don't need to today. The other thing I want to say is about projects and pricing. You know, whether it's the fairgrounds facility or whatnot. If we would have built the fairgrounds facility back in the day, it would have been a heck of a lot cheaper than it's going to be tomorrow or in 5 years to come if we waited out. We're seeing that in transportation projects. We're seeing that everywhere. Everyone can only do the best we can do. We can't control the market. I can't control the price of a gallon of gasoline. I don't know about you, Mark. I know you can't either, right? Right. Same goes for a 2x4 or a piece of steel or whatever we're going to build this project out of. So contingencies built in there to absorb some of those things. Typically, that's goes with every project. You know, we just need to make sure that, frankly, you know, projects that, you know, if they can be, in this case, value engineered, and they can be value engineered and done reasonably and meet the expectations and the contractual obligations as well, then great. But I would be struggling if I was in their shoes. To say or stand before the commission here and say this is absolute. I think they're going to do the best they can, but I can't expect to hold them to an unrealistic expectation that could potentially be out of their hands. Again, kudos, and I hope this is easier for you all as we go. Is there a motion necessary, Gary?
Well, of course there is, but there's a point of reference here. Just a minute. I'm looking at, I think my getting, there's a 2.1 million, okay, just a minute. Let's go to, yes, Paul, are you wanting funding gap options?
Yeah, so the staff recommendation is, I think it was twofold, if I heard you right, correct?
Correct.
Do we
Okay.
make, Gary, just a point of reference, Paul, do we make two motions, or do we
I would-
have
I would
both things in one motion?
I'd recommend two motions, Chair.
Okay, let's work on the funding gap first.
Yes.
Would you like me to make a motion on that?
Yeah, go ahead.
Okay. I move that we utilize $200,000 from ARPA funds distributed to the county to make up the $200,000 shortfall for the construction of the new Gladstone Library.
Second.
The motion has been made by Commissioner Scholl to make up the funding gap with $200,000 of ARPA funds, seconded by Commissioner Schrader. Any further discussions? So what, McGarry?
And just to clarify, if the money is not spent,
I was gonna say
it will
that.
be returned to the county's ARPA fund.
If there's
Very clear.
any
Yep.
remaining contingency, you pay us back first. And then what will happen with that money, it will be redistributed to another worthy organization.
Sure.
Okay,
Can do
thank
that.
you very much. Any other comments? Hearing none. Mary, would you please call the poll?
Commissioner Shull,
Aye.
Commissioner Schrader,
Aye.
Commissioner Fisher,
Aye.
Commissioner Savas,
Aye.
Chair Smith.
Aye, motion passes 5-0. Thank you very much for your service. Good work.
Would you like to make a second motion now about, in general, move forward on the project?
Okay, so if I see that request to proceed, recommendation, I move to proceed with building the library.
Second.
A motion has been made by Commissioner Savas to proceed with building of the Gladstone Library, wee-haw, and seconded by Commissioner Schrader. Holy cow.
Thank you, goodness. Thank you,
Wow.
God.
Any further discussion, Martha?
Another Christmas miracle. Just saying, okay?
Commissioner Savas?
Yes, I just want to remind maybe, I know Martha, you remember some of this, but when Commissioner Smith and Commissioner Ludlow came on board, one of the things we ran head-on into was this library thing. And you came in midstream. I guess essentially I even came in midstream, but I came in 2 years earlier with the Sunnyside Library issue and the Oregon City Library issue and all of this. And so we have this is one of the last two that seals the history of this. And really what this was, I want to make this perfectly clear. The county went and sought from the voters an initiative to create the library district, which really was this whole thing to change, to relieve the general fund of the county, us, the general fund of that responsibility for managing the libraries in this region. So this is really, that effort has led to a cost savings. Otherwise, we'd be funding and programming and doing and running all these libraries. That's not the case. The voters passed it. These two projects, the Gladstone and the Oak Lodge Library, are the last two that seal the deal, and it's done at the benefit of the general fund. So it's going to take a little bit more because it took so long, but we're going to get there, and the end result is it's a win.
This has been going on since 2008, and that's when it passed, because I remember working on that, and it passed overwhelmingly, actually, because we it was a grassroots campaign. It really went through. And I would just say, though, the one thing we still do, Paul, though, we still maintain the computer systems, the connectors, what do we call it? We used to call it Link. I don't even know.
We used to call it
Linus.
Link.
It was
Link
Linus?
Library Services, yes.
So it's still Link, yeah.
Yeah, or Library Support Services.
Yeah, so we do that piece of it, but really the whole idea was for the cities and the unincorporated areas to really start integrating, so everybody, no matter where they were in the county, had access to a library. And to me, building a library is never a mistake, but that's just my personal bias, as you know, because you were a librarian,
I was
too.
a librarian too.
Yep.
Yes,
So,
books
never-
are a wonderful thing, and words printed on paper is even a better wonderful thing. Yep.
Okay.
Okay, any more comments? Going forward, Mary, can you please call the poll?
Yes, Commissioner Fisher,
Aye.
Commissioner Shull,
Aye.
Commissioner Schrader,
Aye.
Commissioner Savas,
Aye.
Chair Smith.
Aye. Motion passes 5-0. Thank you kindly very much.
Thank you.
Thank you. Thank you, staff.
Jason and Mitzi, we'll see you next time you come back when you invite us to the opening house,
Oh, for sure.
Absolutely.
okay, of the new Gladstone Library.
Yes.
And just a comment, colleagues, nationally, when I went to the San Diego conversation with NACO, a lot of the counties are really focusing on projects like building projects that they've had to put off or getting it done because
It's
one-time money, so.
it's one-time money, and it has to be spent carefully.
Yeah.
Yes, yes.
Careful.
Okay.
All right,
Gary.
now we're going to return to the issues list from this morning. Next on the issues list is procurement integrity, assuring equitable and competitive processes. Commissioner Savas asked for this item.
Yeah, this is I brought this up because it's become evident that I think there's a misunderstanding perhaps, or maybe not a complete understanding, not necessarily by any of us on the board, but I think in general in the public, that, I don't think there's an understanding what the procurement laws are and all of that. So I was thinking perhaps whether it is a town hall or maybe it's not really a town hall, maybe it's a session where we bring in some of the folks that are of a certain mindset or nonprofits and so forth to get an ABC 1, 2, 3 from our legal counsel, our procurement staff and everything to educate everyone as to what government contracting is all about and what the rules we need to follow and what the ethics are about it that surround that, and make sure that the procurement and public trust is maintained, and people understand what we can do and perhaps what we shouldn't do, right? All the above. And so I just want to think that maybe that's something we look at early next year as some kind of whether it's an outreach and bring in some of those folks that, I just want to make sure we're following the protocols and we're doing things right and we're running a transparent process that is fair to all. And the process ultimately rewards people that perform well or contractors that perform well, and those that have a history maybe of not performing, they don't really rank up. And we heard Rod this morning say that if a non-performing group applies, they're not going to score very well. I think those metrics and outcomes and protocols, I think they need to be more apparent. And it just seems like the time is ripe to do that kind of thing in an open, transparent way and make it educational, of course.
Okay, my comments on that, Paul, you're just not talking about our departments when they, for instance, buy a product or they contract out for the services to the county. Are we also talking about how our nonprofits operate?
Well, I'm not talking about how they operate. I'm talking about the procurement process.
Well, that is how they operate. I mean, a nonprofit, how they operate is they need to apply for funding to perform a service. Now, in that process, isn't it a procurement or a contract, so to speak? So I would not want the focus just be limited to the county's internal business, but the use of nonprofits as well. That's what I would be interested in, correct?
Yeah. And another way of putting it is that, some people have pressured us, well, commissioners, why don't you just hurry up and just give us the money and we will, we'll do whatever the service they provide. We'll just do it and get it done and it'll be, we'll get the dollars out there faster. Well, is it competitive? No, in that way. If you don't follow the laws are built to be competitive, that where everyone has an opportunity, regardless of their race, religion, or whatever else, anyone can apply as a contractor for a particular thing. So it's really important that things are run fairly, and that's why we have these laws. But I'm reading into this that some people don't understand that we are bound by those laws, both state and federal.
I also hear from folks in the general public who have applied for county contracts, and they're able to provide the services, and then they are not a winner, that the county continues to use the same vendor year after year, contract period after contract period, and then we're accused of cronyism. I think that is a big issue, a really big issue. I don't know how we address that. I don't know why we don't consider mixing it up a little bit. I think our departments are comfortable with using Joe Blow over here, and maybe they don't want to talk to Jane Smith because I have my comfort ability, my comfort lessons in here. And oftentimes, there was an expression, I'm going to hire the best possible person for the job, and the person says that as they're looking in the mirror. Right? As they're looking in the mirror. So they want somebody like themselves, and they don't consider that maybe a different approach or a different company should be considered, because after all, this is tax dollars. And so that's where I'm kind of coming from this, as your statements as well. Mr. Scholl.
Yes, when we get things on the consent agenda that include a contract that's been worked out by one of our divisions, I'm confident that those are being done on a competitive way. Now, a lot of times, like you said, the same company might get hired again, and that's usually because they come in with a competitive bid and they're hired because of their professionalism. If we do have a problem in the county with improper contracting, I'm sure Gary would be telling us about that.
I wonder, you say that, but I wonder if they're able to come in at a more competitive bid because they have inside information.
Well, I hope not.
That the other outside applicants don't. I tend to think that they know what they can, since they've been at the county, they know what they can do, they know what they can get away with and what they can't get away with. When you have new folks coming in, they want to make sure they hit all the bases, right? And so I kind of wonder about that, but I don't know. I've often thought about that as it's brought to my attention. Gary?
I'm sorry, I got to speak up. So there's laws that we follow, state and federal laws and county code on how we do procurement processes. Anything over $50,000 requires a formal request for proposals process. There's a scope of work that's published, and every bidder has to meet that scope of work. And yes, if someone's worked with the county a long time, they know how the county works, but that's open to anyone who applies for a contract at Clackamas County. They can interview staff, they can go online, request information. Staff makes a recommendation. There's a panel that's put together from various departments, no one that actually works on the thing, so that there's no claims of people inserted in the process. Yes, up to $149,999, a director can make that decision. Otherwise, it comes to you, board. If you ever have a concern with the process, any of our staff can show you the exact process of how we go through. So I get that claims, and yeah, there are contractors that have worked with the county for a long time, but my opinion is that they've gone through a really rigorous process to get there. So thank you.
Yeah, Sheriff, I could add to that.
Yes, you can.
And that is that we also have had, because it's not always lowest bid, right? I mean, there's certain metrics, and the total score is really what brings them across the finish line. But we have had experiences where, failure to perform has ended up costing us a lot of money, and we can try to go back sometimes and recover those fees, and sometimes not always, or we expend a lot of staff time. I'm looking at Stephen because I can think of two right off the top of my head that we got burned pretty bad. So, it is important that we hire competent people and we meet all of our other requirements that we've embedded in here in the county. So I just want to I think, maybe it's 2 sessions, I don't know, because it's a meaty subject. It is. But I want to make sure our public are aware and our folks out there that are advocates for whatever it may be, roads or social services or supportive housing services or building housing projects or so forth, that they understand, what our responsibilities are.
And Gary, who would be presenting on that issue?
I like this idea, Chair, Commissioner, so we could have of course, our finance staff who are the technical experts, but public and government affairs can participate. I could do it, Stephen could, commissioners could do it. I mean, we could have like a 101 process for anyone interested in generally how the county does its bidding procurement processes, or also for anyone who wants to apply for a county grant or county funds. I'm not saying we require it, but we could offer. Come to a session and learn how the process works.
Yeah, let's put some
Okay.
thought into that, who would
Yeah.
be presenting on this. I'm inclined to go ahead with this.
Yeah,
Yeah, okay. Yeah, well, let's tee it up.
Can staff put together some proposals of what it looks like? We'll come back to you on what that could be. So,
That'd be fine, thank you. Okay.
Did you have a comment on that?
yeah, I just wanted to say, I think it's a good idea. I know the other larger organizations that, public organizations do, they kind of do the this is what it takes to apply, and I think that's what you're trying to get at, right?
Yeah,
This
and
is what it
I know
takes
our
to
staff have
apply.
done that. I know
they have, yeah. I've
Yeah.
said, but sometimes the nonprofits, if they're new or whatever, it's a refresher course, but we should just make sure.
Yeah, and I think sometimes maybe it's not an applicant or a potential contractor that makes the application, but I think sometimes it's the public that's close to it that hears things that may not be quite right, and this helps clarify that it's really not us.
Well, and just the comments that I brought forward, those are comments that are being presented by me, and my line is the same as Gary. Oh, we go through the process and we abide by law. People, a lot of times that just, sorry, Gary,
It's
but the
okay.
statement doesn't work.
People create any story they want when they don't
Yes.
have the facts. So we need to get
Yes.
the facts out to the community on how we operate.
Yeah.
Understood.
Okay.
Yeah, there is one other, it's not unrelated, but it's another example. I mean, I remember one time when I first got on the commission, someone reached out to me and thought that if I helped them, they could get a job here at the county,
Oh, yeah.
right? And that I should use my political influence to get them hired. And I said, well, that's a process also, right? We're not involved, and we shouldn't be involved. We need to have that firewall between us, our political influence, and that. So that's another one as an example. So there's a lot of public processes, for example. Oh, I don't like that development project. You should stop it. Now, I've had all of that happen. And well, we can't because, that person could appeal and go to, LUBA or whatever else, and we'll lose. And by the way, it'll just be a black eye in the county. So I think there's some of those, this one here, procurement, I think is really important right now. I think it'd be timely.
Thank you for the idea. Staff will put some ideas together and report back to you, Commissioners. Thank you. All right, the final item is Commissioner Communications.
Thank you, Gary. I'm going to go first on this because I need to leave. And then Paul, I'll have you finish the meeting if you would, please. A while back, we considered a Merck appointment, and John Erickson has been serving as our Clackamas County representation for, what's Merck stand for again? The Metropolitan
Exposition, recreation, something.
Basically, it's a tourism appointment to Merck. They recently got a $400,000 grant for the area. I'd like to know what they're going to be doing with it and how it will benefit Clackamas County. Well, at the end of October, Metro came to us and said, we need to re-up the appointment. So this board decided at the time to put it out for a recruitment. The recruitment was not normally as long as we like. We put it out on November 11th. We closed it on the 22nd to be in compliance with the appointment, so the person could be at the next meeting, which is in January. The meetings are monthly. The only person who applied in the 11-day recruitment was John Erickson. So what we can do, Commissioners, it's up to you, whatever you want. We can go with John Erickson, or we can open up the recruitment for a longer period of time and satisfy that the fact that people have, November 11th is Veterans Day, and we're kind of coming on this holiday. Maybe if we open it up for a longer period of time, don't worry about the January meeting. We won't have representation at the January meeting, and frankly, we haven't heard from John what's been going on since I've been here, and maybe you have, but I haven't. So I'm thinking being pressured by a January meeting is not as important as maybe it once was. So what do you want to do? Do we want to reopen the recruitment, or do we want to appoint John Erickson?
Yeah,
Mark, you first.
What is involved with reopening the recruitment? What do we have to do to make that happen, get the word out?
We would just put it back through our normal recruitment process, online, on social media, get the word out that there's a vacancy, and just help spread the word with more time. Just having more time to have it open. might get more
Until
applicants.
January?
Would it be like, how many weeks would that be, Gary? I don't,
Normally, we do 4 weeks for an ABC recruitment, so we only did about a week for this one.
11 days, it's like, not even 2 weeks.
Yeah, well, I don't see any harm in doing the 4-week recruitment period. And at the end of it, if we,
If John's it, he's it.
yeah, that's right. There
Okay.
you go.
Martha?
I'm okay with that. Yeah, let's do
Paul?
a 4-week.
Commissioner Fisher, did you hear the conversation?
Yes, I did. I'm fine going with what everyone wants to do.
Okay, good. So Gary, let's go with another recruitment, and let's be a little bit more vigorous and advertise on that, and explain what MERC is.
Yes, and the title is the Metropolitan Exposition Recreation Commission. It advises Metro of oversight of the 3 Metro visitor venues, the Oregon Convention Center, the Portland Expo Center, and the Portland 5 Center for the Arts.
Thank you very much, Commissioners. I do have a little bit of time. Who wants to speak next?
Well, I've got a call, so I'm just going to tell you, just Commissioner Communication, the Lake Oswego Rotary asked me to speak the other day, and it was a really great meeting, and I did update them on our SHS, and they were very receptive to it, our service delivery that we're doing with, from the extra dollars coming in. So just want to let you know we're getting the word out there, that we're doing a good job, and that have always been dedicated to social service delivery systems in this county, and it was a welcoming audience, and it was a great.
Well, you've always been a
Good to hear
champion
you.
for that, you and Commissioner Fisher and Commissioner
Well,
Savas.
thank
Well,
you.
we all really have been, but you've been at it for a long time.
Yeah,
I
it's
appreciate your
been-
dedication to that and talking so much about it.
So that's it for me.
All right,
I've got a
Mr.
3 o'clock
Savas?
call, so.
I don't have anything in particular, just a lot of things going on the transportation world, and Mark and I sat in on the Oregon City Business Alliance meeting, and some folks from ODOT made a presentation, and I believe Oregon Senator Kennemer stood up and made a statement that he was going to introduce a bill in the early part of next year. February, that would perhaps require a vote within a certain mile radius of a tolling project. And as we learned, I think we all learned here about a week or 2 ago, that another 2 citizens filed a petition for something similar to that. So I'm going to be looking into that and see what legal or legislative counsel's opinion is on that particular second measure, so we understand how it's effective. So we're warming up into our session next Wednesday, which is the tolling town hall, so that we're all warmed up for that. There's a lot of stuff going on out there. At the JPAC meeting last week, while we were in AOC, I attended in the morning the JPAC meeting via Zoom. There is really, and I said this afternoon, you heard me this afternoon at the OCBA, there is this really anti-road, anti-lane sentiment out there, stronger than ever before, whether it's coming from the public or whether it's coming from elected officials in this region, decision makers. And it's kind of concerning because I am very concerned that people are not thinking ahead 20, 30 years from now, when most of the cars are no longer fossil fuel powered, they're electric or hydrogen or some alternative fuel. And we have a population that could be perhaps double or 50% more what it is today. And we're having a hard time right now moving goods and services and commerce down our roads right now. And, when Governor Brown did her tour in 2016 and 17 prior to HB 2017, she heard all around the state that the #1 transportation challenge, no matter where you were in Oregon, was the Portland metro area, because not being able to get goods and services through. So it seems to me we ought to be assuring capacity, and if their capacity is simply just to congestion price everything, and not build the capacity thinking ahead. If we're going to be building the interstate bridge over the Columbia, that's a huge project, and that's got to be able to last and withstand and meet the capacity needs in the future, we've got to be thoughtful about this. We can't be making these multi-hundred, 7, 8-figure, 9-figure investments without being thoughtful about making sure that investment can last and has the capacity to meet our growth needs. But just want to kind of let you know, alert you to all that, and that's what I have for today.
We're talking about our town hall and transportation next week. Sue Hildick and I were talking about that, and this particular transportation town hall has certain players involved in it, and Paul, you did that. I do think a second town hall on this issue is warranted for next year, and we're working on that. And as things develop, as, you know, the metrics could be changing, and so we're going to revisit it, because I don't think, I think this subject warrants it, let's put it that way. Yeah, okay. Commissioner Fisher, do you have any comments?
Yeah, thank you, Chair Smith. I just wanted to let folks know, mostly Martha, since I haven't had a chance to talk with her, the Human Services and Education Committee of NACO came up with their top 3 priorities, of which childcare is one, which is great. So that's good news there. And next week I will be going to a leadership symposium for birth to 3. And also after that is the LUC, it's the, what is it, the L stand for, Martha?
Large Urban County Caucus.
Large Urban County Caucus, we just call it the LUC, and they're doing some really interesting tours. I'm gonna not be there for the whole part of it, but for some of it to be part of that, and I'm pretty interested in looking forward to that. And then I'm happy to report I woke up this morning with a sore throat, and sore throat got a lot worse during the day, and I was thinking, oh no, this is turning into a terrible cold. But then my husband went to the store and bought some popsicles, and you know what? It actually feels a lot better. So I think I'm going to survive this. So thank you for letting me feel safe and keeping all of you safe, just in case I would be having something that I could spread today. I appreciate it.
Well, thank you, Commissioner Fisher. Get well. We look forward to seeing you tomorrow.
I hope I didn't give you anything.
Commissioner Scholl, you're up.
Yes, good afternoon. I'd like to thank the Oregon City Business Alliance for an excellent briefing today and lunch. Like Commissioner Silva said, ODOT Metro, they're looking at congestion pricing and tolling. They're not talking about arterial lanes. Now, if we go back to 1970, before I-205 opened up, just imagine, I-205 was never built. And instead of building that freeway, we tried to take care of transportation using mass transit. Where would we be today? And so I urge anybody out there who is in Clackamas County to get involved in this tolling thing. We've talked about it before. Of course, we have our town hall this coming Wednesday on the 1st of December. So please be there. I would like to thank Commissioner Pat Farr from Lane County for the tour we had of supportive housing projects in Lane County last week. A couple of things were really impressive. One was their building called the Commons, where they have 51 units where they house people with mental health issues. They have 24/7, 365 nursing personnel on hand. And that project has reduced 911 calls and emergency room calls in Lane County. I don't know the exact number, but it's a pretty significant percentage. That was very impressive. Also, they have a small house village that they're very proud of called the Opportunity Village. And I think that's something that we need to look at as we draw down our expenditures in hotels. And I think Clackamas County can do something along that line, but I think we can do it even better. And so thank you again to Pat Farr for that great tour. Thank you. He sure is a great guy.
Yeah, can I just add something to that?
Yes.
So one thing I just want to just say that as we're watching this evolve with these shelters, that the units themselves are a lot nicer and have a lot more amenities in them. heat, electricity, options for plumbing, and so forth. And the interiors are nicer, easier to clean, and so forth. So these are not, these are not what we have originally that started out at the Veterans Village. That was all a PSU program that we worked on and built. So, but, the model, the way it's managed, I think is a good one. And if you look at the cost per unit and the cost per person, it's hard to beat. It's hard to beat. And the fact that it's got portability to it. It's not permanent. And you can put them up way faster than we can build just one.
Thank you very much, Commissioners. Gary, do you have anything?
That is all.
We are adjourned for today. See you tomorrow.